In 2009, government took a decision to make education an apex priority of the 5 priorities that we outlined. This is the apex, it's number 1 priority. In 2010, in the State of the Nation address, I committed government to strengthen health programs in public schools in our country. We also began speaking about introducing a national health insurance scheme which would extend quality health care to all, whether rich or poor, urban or rural. We've gathered today to fulfill those government commitments through launching the Integrated School Health Program. The program forms part of the National Health Insurance Program, which is in line with the World Health Organization's call for universal health coverage around the world, regardless of people's economic status. Currently, it is only 16% of the population, those with medical aids, who enjoy excellent all-round quality health care. Only 16. We want to change that scenario and extend quality health care to all, hence the launch of today's program. Tshwane is one of 10 districts in which government is piloting the National Health Insurance System. We will work through 3 pillars as part of initiating the NHI in schools, municipal wards, and in districts. Today, we are launching the first pillar, healthcare in schools. Promoting child and youth health, we seek to correct a few shortcomings and problems that we face. Firstly, we have to deal with the problem of unhealthy diets and lifestyles. Secondly, we want to focus on promoting child mental health. We want to prevent and deal with the abuse of alcohol, tobacco, and other drugs in our schools, working with the basic education, health, social development, and police department. We must not take the issue of mental health lightly. Local studies show that a significant proportion of learners experience mental health problems. The most common are depression, anxiety, and substance abuse. In the extreme cases, many tragically commit suicide. The most common risk factors for the youth are conflicts at home, exposure to violence and abuse, poverty, poor social support, lack of opportunities, and peer pressure. What we parents are commonly not aware of is the kind of an impact we make to our children in the manner in which we behave in our relationship as parents. The impact we make to the kids is very serious. They are there, helpless, they can't intervene. So it impacts on them very negative. At times, the effects of that are not realized until they are grown up, and their behavior would be reflecting what was planted in their system when they were young. It's very important that we should be aware of as parents. Because of these pressures, some of the children end up performing poorly at school. Thirdly, it is a problem of high teenage pregnancies, which indicates a shortcoming in youth education. I'll come back to this point because I want to deal with it clearly to all of us, because we must appreciate the problems and not look away from the problems and hope that on their own the problems will sort things out. They need us. Fourth is the need to arrest the spread of HIV, which I will refer to later in this presentation. Our new school health programs seeks to correct these challenges and offer a more comprehensive service. More than 500 health professionals have already been trained to deliver the school health program. Services will be provided by school health teams, each led by a professional nurse. The teams will also include enrolled nurses, oral hygienists, and health promoters. The provision of health information and education will be aged appropriate. We will target each of the 4 educational phases: foundation, intermediate, senior, and the further education and training phases. In the early phases, services will cover environmental and personal hygiene, especially the importance of hand washing, healthy eating, the promotion of physical exercise, and safety. Health professionals will also check the ears, eyes, immunization status, and the nutritional status of children. In the intermediate phase, attention will be paid to mental health issues, including depression and suicide, as well as issues relating to substance use. Information on sexual and reproductive health and rights, as well as HIV and AIDS, will also be introduced. About 3/4 of learners who become pregnant leave school at the time of the pregnancy, and only between 1/3 and a half of these return to school. So the teenage pregnancies stop the development of young people. They become just warm bodies, not empowered to make a contribution in society. It is almost always the girl child who has to deal with the stigma and other negative consequences of the pregnancy. We are reminded of this fact more strongly today as it is the International Day of the Girl Child. Equipping girls and boys with information on how to prevent unwanted pregnancies can thus play an important role in ensuring that all learners reach their full potential. Because generally, once there's pregnancy, their full potential is undermined. We know that this subject makes parents uncomfortable. Understandably so. No parent wants to discuss these matters with the child. But we have to face the reality that some learners are sexually active, no matter how much this knowledge troubles us as parents. It's a fact, and we don't want to experience the worst. Because if you shy away from the problem, one day the child is going to get pregnant. Partly because they had no knowledge, they did not know when they started being active what to do, what not to do. Let me emphasize this point, because I know parents are saying, wabua now kanto yena ritlaring kuna le bangwana ba rena mo The Minister of Health yesterday in a meeting I'm not going to describe was attacked very seriously. You can't be talking about sex with kids, you know? And that can only emerge from two factors. Either because your religion is such that you don't talk about these things, or your culture. I may not know much about religion, but about culture, I think I do know a lot. At times we believe this education was not given to children. It was. There was a system that was used. In my culture, bigger girls were given full responsibility to the young ones. They had their names, they were called them makrigis. And the mother will have nothing to do with that subject. And the full responsibility will be with the elder one, who looks after the younger one. There could be a group of them. They are then told how to behave as girls, how to interact with boys, what to say, what not to say. When they reach the age where they could fall in love, they are also told, we have now reached a dangerous age. If one day you think that there is a boy you want to accept the proposals, tell me, because you don't know how to do it. So in fact, even the acceptance will be done by Integated. And there will be strict instructions. You'll never meet on your own anywhere. If this fellow wants to visit the girlfriend, we'll ask, come to ask permission from Integated, who will bring the girl, make it easy to see her, sit there, look at them as they talk. Oh yes, that's what it was. And the man will never make a mistake. Whenever he wants to see his Tandosak, come to the Integated. Giyakupa bandla, ngikupa umbono. And then, when they think they can now meet on their own, he will come to ask for permission. That I now want to come to visit, to be with her. And that's how we do it in Zulu. On that day, this girl will be given a graphic lecture about sex by the Integated, and she will be told how to prevent pregnancy. She will be given a lecture that she has never heard before and be told the whole evening that is how you are going to behave. Very clear. And instructions will be, in the morning, the first stop is me, come to me, to give a full report, what happened at night. And when the elder girl says to this man, here is my younger sister, he is given strict instructions. You don't play around with my young sister. You know what I mean. Behave. So their coming together is known by the necessary people with authority. And in the morning, and this young girl will be told every stage what is going to happen and how she must react to whatever happens, which was aimed at keeping her within her own. Nothing must go wrong. And in the morning, first stop will be Integated to say, tell me what happened. She will have to tell the story graphically as it is. If the man wanted to cross the line, that girl Integated will tell the young girl, from now, this is not your boyfriend. And the boyfriend will be told, never come near to this girl. Now this helped because it firstly protected young people from sexually transmitted diseases until they'd grown up. It protected society from teenage pregnancy. You might look at it as the backward thing, but it actually brought upright behavior. So it's not true that sexual education was not there. It was done in a particular way. That's why today the young ones were very happy to interact with the nurses. They were saying we are more comfortable than in the clinics, because in the clinics they are harsher, they are very authoritative. Here we talk with people. And men, young men, were also, once they reach a particular age, I don't know in other cultures, in Zulu simbuza ngesizulu ukuthi mfana sizophuphisa lukazi ngelinye ilanga mawulela. Yes, because the bigger ones are realizing his voice is turning, is becoming bigger. He now begins to realize he needs to cover himself. And the day he dreams the old lady, once that happens, uvuke kuseni ungakhuluma nabantu besimame ukhiphe inkomo uhambe ngentabeni. And when he comes back, big men are going to sit down with him and say, boy, you are now dangerous. You no longer play hide and seek. And he's then told what is going to happen. So education was on both sides. Now I'm making this point because we don't need to shy away from talking about it. Because the more we don't say anything, the more the damage to our society. It's very important. We need to find a way. And I agree. I don't think I can talk to my child and talk all the details. But I must be able to say to the family girl who's bigger, talk to them. But today is better. There are nurses. There are health workers who could help. Don't hope nothing will go wrong. One day you'll be surprised. And yet you have all the knowledge because they might indulge without knowing what happens. So it's important. And therefore this education that is being introduced by government helps to deal with us who are now shy parents, to take measures to help our kids so that those who are professional on this are going to deal with our kids. I said I wanted to underline this one because parents tend to be shy about problems. And once a child is pregnant, you don't know what to do. You are no longer any shy. You begin to say, what must we do? What must we do? It's important. This, I was saying to the minister, this is a revolution in the lives of our people in this country. It's a revolution, I can tell you. To deal with this reality and promote primary health care, the school, health nurses, and teams will provide sexual and protective health services, including contraception, as well as HIV counseling and testing where appropriate. It is a fact that our young people are at risk of contracting HIV infection because you don't know what they do, where they are. Figures from 2010, antenatal HIV prevalence survey showed that more than a fifth of pregnant young women between 15 and 24 years of age were HIV infected, as were 1.4% of girls who were pregnant. Thus, we have an obligation both to educate our learners on how to prevent HIV infection, and also to ensure that those who are infected are identified and receive the treatment, care and support which they require. It is a painful reality of the times we live in. We have to accept that reality and therefore react to it so that we avoid the pain. We wish to emphasize that the package of sexual and reproductive health services will be provided by a professional nurse in a one-on-one private and confidential consultation. What government is doing is making the service available to the learners when needed, with the support of parents. Of course, the emphasis should be to persuade and encourage the young ones to abstain. First prize, abstain. Only come to these measures, say if then you have difficulties, then these are the measures to take. Where in one class, one young fellow was talking about circumcision. He says, but they tell us we must, after 6 weeks, we must not have sex. Kitwe madoda lengane. Ayina mahloni kusibuza impela nje kusitshela lo mbuzo. Because they ought not to be talking about these things. They must talk about it in the confidentiality with their people. But in any way, that tells you, of course, how knowledgeable they are. Thina sasazi ukuthi ingane mayizalwa ifike nebhanoyi. Yeah. Sijabulele lokho nje ingane ifike nebhanoyi. Bathi awuzange adlula. Huh? Ezanamhlanje zazi kahle. That's why you must take these measures to prevent the painful situation. These services will be made available after consultation with the school community led by the school governing body. We urge parents and communities to give the intervention a chance. It is important for the children and for the community at large. Ladies and gentlemen, we call this new health program an integrated health service because many departments come together to provide various services. The Department of Health will provide health care. The Department of Social Development will assist learners who are found to be vulnerable and in need of care and support. The Department of Basic Education and Sports and Recreation will promote physical education and sports to ensure healthy lifestyle. Wednesday afternoons will become magnificent Wednesdays. They will be allocated to school sports as well as establishing school sports leagues. We encourage all schools to participate, as our intention is to develop talent from our schools for our national sports teams such as Banyana Banyana, Bafana Bafana, the Springboks, or the Proteas. Over time, more services will be added, especially in the NHI pilot districts where services will be provided using the mobile vehicles on display today, as you heard from the Minister of Health. We currently do not have the resources to provide these services to learners in all grades and in all schools in the country. We have therefore chosen a phased approach. We'll start with the no-fee schools, which include the most disadvantaged schools in the country that serve our poorest communities. We have consulted widely with school governing bodies, formations, teacher unions, principals, associations, and with education officials. We have received resounding support for the program. We'll continue to work with parents school by school as we implement the program. Full implementation will require additional resources, including health professionals such as professional nurses, enrolled nurses, and health promoters. The provincial departments of health are recruiting retired nurses in order to increase the human resource pool that will render the school health service. We are very excited about the program, as it will greatly assist in preventing illnesses and reduce the burden of the health system. Ladies and gentlemen, we would like to acknowledge the support from our development partners. I wish to take this opportunity to thank the European Union for the support, especially with regard to procuring the NHI pilot school health mobiles and health screening equipment. I would also like to thank other partners such as UNICEF, the World Health Organization, Love Life, Soul City, and others who worked tirelessly in developing the integrated school health program. We count on this team to continue their work to ensure that the implementation of this program is a resounding success. Before I conclude, allow me to use this opportunity to wish all our grade 12 learners around the country successful final year examinations. We want you to do well and will support you all the way as parents, teachers, and government. Ladies and gentlemen, we have started this journey together. We must keep our promise of improving the lives of the children of South Africa and to build a successful, healthy, and educated nation. There is no nation that can develop and be self-sufficient without education. Education is the key, is absolutely the key. Once society is educated, there will be less crime, there will be less unemployed people, there will be less everything. The behavior will be cultured as well. But without education, what else can people do? They then indulge on wrong things. The very vision about themselves and about their society is affected by the fact that they are not empowered to exercise their own mind about their future, their ambitions, their wishes, their dreams. When you drink too much, you have no time to drink proper things. You drink about a tavern. That means nothing. You drink about kuti puzuchwala bambonga. And yet you need to dream about what you want to be, where you want to be, what you want to do. How could you get there? Very important. It's not impossible. It is possible. So all of us, in fact, even those who are my age, imfunda ikhulele. Yeah. Ukhona abet. Asishone khona. It empowers. You'll realize after a few years how powerful you'll be, rather than to be less powerful. Very important. Education is crucial. That is why it receives the biggest budget, because we want that in few decades, South Africa must be a country of educated people. No country can become developed if it has people who are not empowered with education. You will always be referred to as a developing country. And I don't think South Africans want that. I know you don't want to lose in sport. Don't lose in education. Be a winning nation. This program today brings in an important element in the nation building. When we talk about nation building, it means educating and looking after our young people, our youth. And that's what we are beginning to do in a very real sense. I think you can begin to see the fruits of freedom. When I came here, as we were walking this side, the principal said, this school was built after 1994 or in 1994. So we laughed, we said, it is a bond-free school, because people love talking about the bond-free. But he then said, it's a wonderful school, there's a lot of people, it's the only high school in the area, but you don't have a hall. I was shocked. Don't have a hall, what happens if the kids have got to come together? So I said to him, I'll connect him with the people from my office, because I don't accept this. Since he has, since the principal has raised the matter with me, I'm now committing to the community to build the hall. I will. I'll find ways and means. I don't want to interfere with the budget of the basic education, where they're going to say, like all government people, we have no money. We have no money. No, this one, I will make means that we have a hall. We should be used. We should also be used by the community. I'm feeling very happy, and I'm happy you raised the issue when we were in the happy mood, when I kept on saying to the minister, this is the revolution, not so. And I mean it. It's the revolution to our society. This one we have done today. And I'm saying it because our partners are here, development partners. Because I want them to repeat this many times, so that we can be good friends with the, with the European Union. If you empower us, you help us as we empower ourselves, you are creating good friends. The benefit will be two ways. You'll have scientists and everybody will come out of here and help you there. We are a young population, and we are many. We can help. Thank you very much indeed. But thank you for your generosity and others. This is a friendship and relationship we really admire, and we are happy about it. Ladies and gentlemen, it is now my singular honor and privilege to officially launch the country's integrated school health program today.